Good morning, everyone, and welcome to the Health Committee for the Council for the County of Renfrew. It's Wednesday, April 12th, and the appointed hour of 9:30. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we are meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have been careful stewards of this land for millennia. Ms. Hill, has the roll been called, please?
Yes, Mr. Chair, it has.
Thank you.
We have quorum.
Thank you. I would invite now disclosure of pecuniary interest and, if any, the general nature thereof, please. I recognize none. I'd seek now a motion to approve the minutes of the meeting held on March 8th, 2023. Moved by Councillor Grills, seconded by Councillor Weir. Any errors or omissions? Seeing none, all in favor? That is carried. Thank you. There were no delegations at the time of mailing. I'm presuming that continues to be so, Mr. Kelly?
Yes, it does, Chair.
Thank you. With that, then, we will get directly into business this morning with the Emergency Services Department report. Chief Nolan, the floor is yours.
Thank you, Mr. Chair. Through you to members of committee. I'm going to start with information item number 1, the RC VTAC announcement for today's report. On Friday, March 24th, we celebrated at Renfrew County Base that MPP John Yakubuski announced the Renfrew County Virtual Triage and Assessment Center will become permanent service in the County of Renfrew with an initial investment of $3.2 million for 2023-2024 attached as ES1. And this was a letter from Mr. Evan Mills, the Director of Digital Health Program Branch, Digital and Analytics Strategy Division, confirming operational funding for 2023-2024. So Mr. Yakubuski did outstanding job in terms of celebrating with us and stewarding the future of VTAC for the County of Renfrew. John made clear that VTAC is a permanent program with the province of Ontario for the County of Renfrew, which we were very happy to hear. We subsequently received this letter from Mr. Mills, which is a 1-year funding letter, which allows us to then be able to continue operating the funds from an administrative perspective. There is a second item within the report as it relates to OHIP billing, and the OHIP billing mechanism for the physician compensation has had an extension province-wide for assessment centers until June 30th, 2023. So we're looking forward to the arrangements that the province makes for our VTAC physicians to be able to continue their billing beyond that period. I see this as a 3-month window where the province can then land a permanent funding relationship for the physicians, much like the permanent funding commitment that was provided for the VTAC program itself. While it may have been nice to have a multi-year funding window, we do have the confirmation again on the administrative side of the $3.2 million, and now we need to work with the province in terms of landing an appropriate physician compensation model beyond June 30th as per the OHIP letter between OHIP and the Ontario Medical Association in terms of the COVID physician fees. Item number 3, Mr. Chair, related to COVID funding is a letter from the Assistant Deputy Minister, Susan Piccarello, related to funding details, and there are 2 envelopes here. One is for last year's calendar year of $1,236,452 for 2022, and then an additional $357,470 from January to March. So those funds were anticipated by the province. We had been submitting our COVID-related expenses and projections through last year, but we did not receive confirmation of that funding until we received this letter from Assistant Deputy Minister Piccarello. So very pleased that the projected amounts have come to fruition for the county, and as you may recall, last year on a number of occasions the province was asking us to report those details as we went forward. So very pleased for that. Item number 4, Mr. Chair, related to the emergency management portfolio. On March 29th, we worked with Emergency Management Ontario so that they would provide senior an elected officials workshop on emergency management. There are many new council members and mayors and reeves across Renfrew County, so we created an open space at Horton, 2 sessions, one in the afternoon, and that was the Data County Council, as you may recall, with an odd weather day in the afternoon, so we didn't get quite the turnout in the evening that we had hoped, but thanks to those who did make the time for attending those sessions. And just in line with that, and those who attended this workshop and those who did not, the Ministry of Natural Resources is posting the freshet information today related to the rise of our rivers and flood season. So keep an eye out for that information as well. That'll be posted on their website, and I'm sure will be emailed to your staff later today as well. Item number 5, Mr. Chair, is related to the Stryker ProCare defibrillator maintenance agreement. So these are the monitor defibrillators that we have and we own here in the county, but this is an annual contract. They're beyond end of life, these units that we have. These are the big monitor defibrillators. We've chosen to continue with them beyond end of life, but having a maintenance agreement. So this covers off cables, batteries, pads, and those types of things that you would expect to both be used, but also towards end of life, especially batteries are something that are worth warrantying, because as they expire, it's nice to be able to swap them out for more reliable units, just given the nature of the technology associated with that. So this is a 1-year agreement, and we're going to be using this 1 year to look at a renewal of that fleet of monitor defibrillators throughout the service. But this contract for preventative maintenance will service 33 LifePak 15 units that we have within the County of Renfrew. Mr. Chair, and I think to Craig and Jeff, how would you like to work through items number 6 as it relates to the unaudited financial statements and the paramedic reserve allocation?
Through you, Chair, or to you, Chair, I believe Mr. Foss is ready to go at any time, so it's up to you.
Maybe what we'll do is just finish the information. I think there's only one more information item, correct? Yeah, 7. We'll finish the information item and we'll come back through and we'll address item 6 on the second lab.
Sure, thank you, Mr. Chair. And number 7 does relate to number 6 in terms of the utilization of reserves for community paramedic funding. So I'll leave that for Mr. Foss as well. And then we do have bylaws 8 and 9 within the report.
Okay, thank you, Chief. With that then, and information item number 1, returning at the top of page 2. Committee, any questions or comments on the VTAC announcement? Very, very pleased, and also want to echo the Chief's comments. Many hands were required to put this effort forward, but certainly much appreciation to Mr. Yakubuski on his unswerving dedication seated around the caucus table in Toronto. I think that was quite important in moving this file and getting us to this place. So thank you once again to him and all of those who put in such outstanding efforts. Item 2, the Ontario Health Insurance Plan Information Bulletin. Councillor Nicholson.
Thanks, Chair. Just a question. This costing mechanism is vital for the existence of RCVTAC. Is that correct?
Yes.
And I know the Chief had mentioned that we were working towards extending this beyond the 30th of June. Can you just amplify who's the we? Is that the county, or is that a different agency within the province, working with the province?
Chief Nolan, please.
Thank you, Mr. Chair, and thank you for the question, Councillor. So the relationship between the provincial government and the Ontario or the OHIP billing office and the Ontario Medical Association really is a negotiation in terms of funding models for physicians in Ontario. You may recall last fall there was a reduction in the virtual care stipend for visits. It went from $30-something to about $15 for a doctor, which is what they would be repaid as part of a virtual walk-in clinic type model. It's been acknowledged that the virtual assessment centers have been working under a sessional code fee, which is essentially a flat rate amount, which is a unique billing code during the pandemic. Now that we're moving out of the pandemic phase and clinical assessment centers are winding down, because VTAC has received confirmation that it is continuing, the physician compensation model needs to now be renegotiated by the Province of Ontario and the Ontario Medical Association, so that funding, I would expect, will likely flow through Ontario Health to the VTAC program for the reimbursement of those physicians. Or the province will be negotiating an OHIP code whereby the physicians working in the VTAC program can submit their billing to OHIP for their involvement in the VTAC program specifically. There are a number of alternate funding relationships around the province, some for refugee management, for example, some for other specialty clinics. We don't know, meaning the county, doesn't know where that's going to land, but we, the county, are working with the province to ensure that they understand part of the success of the VTAC program is the funding model that's available for the physicians. And that's not just at the dollar amount, that's based upon the ease of being able to submit costs associated with their involvement in the program and the predictability of those billings in terms of the revenue for those physicians, right? We've been working very hard to provide stability on an hourly basis for the physicians. That's different than a fee-for-service model where the physician might submit for this type of assessment versus that type of assessment for this type of patient versus that type of patient. We've simplified that model and standardized it based upon the assessment center codes, which are likely to go away, and we need something that's better than the current virtual visit model, which is a piecemeal model based upon individual visits at a significantly lower rate than even a fee-for-service model would suggest. So the we is, our job is to educate the province so that they fully understand VTAC and the role of the physicians and part of the success of the program as it relates to the physician compensation model. They, the province and Ontario Health, likely will inform discussions with the Ontario Medical Association so that that system can be put in place prior to the deadline of the OHIP extension that just came out.
Thank you, Chief. Follow-up?
Yes, thank you. No, perfectly clear for me now. Have we done everything we can do as a county to advise the province on that position? Or is there any subsequent action that we need to recommend to county council to take from this point forward?
Chief?
Thank you, Mr. Chair. As it pertains to the physician compensation model, I think that the Premier, Minister's office has clarity in terms of what's important in terms of the physician compensation model. I don't believe any further action is required at this time, and we've received assurance that this is a top-of-mind issue in the Minister's office so as to resolve it, not only for VTAC, but there are a small number of other programs that have emerged from the clinical assessment center model that was COVID-related that need to be resolved for other parts of the province as well. So not VTAC, but other models that have been relying on a similar compensation model. So I'm satisfied that they have all the information that they need. I think it'll be important for us to check in with them on a regular basis in terms of keeping it as a high priority, but I'm confident that they have all the information they need right now to be able to land it with the OMA and the physicians group so that we can continue to operate especially on the physician side of the compensation model.
Thank you, Chair.
Thank you. Anything further on item number 2? Item number 3. At risk of confusing, before we get into the financial statements, just a question because the funding, the COVID funding has been piecemealed, and I think that's perhaps the process that has been followed from the inception. But in the Q1 2020, we were anticipating $0 by Q2. That grew to $458,000. And then in the year-end financials, it's showing a figure of $1.16 million. So my question, I guess, and perhaps to Mr. Foss as much as to the Chief, the $1.2 million, does that include the 1.1 that is currently shown as COVID funding in the paramedic budget, Or is this in addition to the 1.1 that is shown on the year-end financials?
Thank you, Chair. The $1.1 million reflected in your financial statements is the same as the funding letter for $1.2 million. So there are slight differences at the beginning of the year because of pay period accruals, and at the end of the year, the final pay of the year, another pay period accrual. But other than that, this is one and the same. So there's not an additional 1.2 million coming to us. This 1.1 million directly offsets our salary, benefit, and direct purchasing costs related to COVID in 2022.
Sorry, so if I'm understanding correctly then, so the 1.16 million is already included in the 1.23 million. So really we're only talking then about, what's that, another $70,000?
Thank you, Chair. What we're able to reflect in our financial statements is COVID revenue that exactly offsets our COVID expenditures for the period in question, being January 1 to December 31. So our actual COVID costs reflected in the statements are $865,020.85 in salary and benefits, and $295,135.72 in additional accounts payable purchases, for a total of $1,160,156.57. So that is the exact expenditure that we had in paramedic services, and we've recorded as revenue that offsetting amount in the financial statements.
Okay, I guess the next question, the follow-up question then is to the chief. So given that there's been an additional 1.2 million that seems to have been authorized here, are there other costs that we have assigned as non-COVID just simply to capture them, or are there additional COVID costs other than those that Mr. Foss has identified? Because if we've captured all the costs, it seems like there is not much left to utilize from that additional dollars.
That's correct, Chair.
Okay, thank you. Anything further on item 3? Anything on item 4, the Emergency Management Senior and Elected Officials Workshop? Councillor Grills, please.
On behalf of the folks from Head Clare Mariah, we were very happy to be invited to that. Unfortunately, I had to play hooky here, but I didn't mind doing that at all, for some reason or other. I think one of the best things for us is the fact that we're invited to those. We don't have to pay for them. We just have to come up with the mileage. And also trying to encourage my new council to be part of the management program. This will be the 3rd meeting that our council has had and workshop about emergency management. The most interesting question that was asked from your presenters, who I understand come from larger urban areas, as did I, it was a rhetorical question. Who does not have a fire department? Well, 3 of us said, we don't. And it brought about quite an interesting discussion after the fact, after the workshop. I met a number of new councillors from various parts of Renfrew County who were quite interested in our position. Very, very happy to have these workshops because our municipality does not have a fire department to depend on when there is a serious emergency. I do know, however, there are certain people I could call if I really needed help out of my my borders. And thank you again, and thanks, Steve, on my behalf. Thank you.
Thank you very much, Councillor Grills. Anything further on item 4? Councillor Nicholson.
Thank you, Chair. I just wanted to echo, I didn't have an opportunity to attend, but I do appreciate the focus and to have workshops like that. I'd also like to encourage or recommend that we consider additional workshops, even if we could take an example and pull in speakers where there's an upper and a lower tier relationship, and have them speak to an emergency that they've had to work through, the complexities of it and some of the lessons learned, just to give us some additional context. If that was something that could be considered, I think I would appreciate it. Thank you.
Thank you, Councillor Nicholson. Springing to mind right now, perhaps the Director of Public Works might be available. I know that he has participated in several emergencies when he was posted in Alberta. Maybe that we can extend an invitation to him to kick things off. Anything further on item 4? Councillor Murphy.
Thank you, Chair. And on the way in, Councillor McKenzie said, I don't know about, flooding, and I said, don't ever say the F word to me ever again.
Thank you. Anything further? Seeing none, item 5, the Stryker defibrillator maintenance agreement. Seeing none, I guess we can probably combine, I think 7 is integral to probably 6 as well. So with that, Mr. Foss, I will yield to you. I think page 14, if memory serves, is the first page of the financials. Yeah. So the floor is yours, Mr. Foss.
Thank you, Chair, and good morning to members of the Health Committee. As the Chair mentioned, that particular appendix then begins the unaudited or draft financial statements for the Paramedic Services group of departments. There are 3 of them listed on that financial statement. The first one, the largest one, of course, is, we would call it our 911 program. Next to that, we have a group of related paramedic departments, paramedic other, that we call it. That would be our original community paramedic program, the community paramedic long-term care program, our vaccine program, VTAC, of course, our assessment centers, or our VTAC centers, as well as at the very bottom, our VTAC administration, which is our medical reception program. Below that is emergency management, which is another department that falls under the direction of Chief Nolan. So just going back to the very first group of departments, the largest one, the 911 program, you'll see that we had a budget, a municipal levy budget approved by Council in 2022 of $8,663,000. In the 2022 budget, similar to 2023, we had a target operating expenditure increase over the previous year of 2.5%. Council did approve the Paramedic 911 program to be slightly higher than that. There was an approved operating increase in the 22 budget of 4.3%. The actuals for 2022 came in at $9,895,000, so that's roughly 14% over budget. Similar, so the over expenditure is $1.2 million for the County of Renfrew. Of course, we have a funding partner, which would be the City of Pembroke. They are paying a share of the net municipal paramedic costs based on population. And so, of course, they had a budget of $1,244,000, and their final cost share amount was $1.421 million, again, 14% higher than the original budget. I'm just going to direct your attention closer to the bottom. You'll see a big, large number there, revenue provincial subsidy. We budgeted $9,312,000, and we do that based on our council-approved 2021 budget. So just a reminder for this committee that the province of Ontario doesn't care about cost sharing, actual costs at the end of the year. Neither do they care about what you approved in your 2022 budget for your actual costs that you expect in 2022. They base their funding on a prior year. And so understanding their methodology of their process for funding paramedic services, we were able to very closely anticipate how much money we were going to get from the province when it came time for council-approved budget for 2022. And you'll see we're within $3,600 on $9.3 million. So we knew early on how much the 50-50 revenue share was going to be from the province of Ontario, and so that number is a set number. There's no adjustment that can be made to that. The province protects themselves by being a year at least behind in their cost-sharing agreement. Any dollars over and above that 50% share are our dollars. We pay it. There's no opportunity for us to reclaim any shortfall. The other thing that's happening within, of course, paramedic services, and the chair asked me to speak about it earlier, was there are significant COVID-related expenses in 2022 in the paramedic services department. And as I mentioned, just above the provincial subsidy of $9.3 million, you'll see a provincial revenue, one-time COVID revenue of $1,160,000. And as I mentioned, it offsets $295,000 worth of COVID-related purchasing, that are a number of items, so goods and/or services that have to be incremental costs that are related to our COVID prevention or mitigation activities. But in addition to that, we had tracked $865,000 worth of salary and benefits related to COVID, and the way we do that through our payroll system is that anytime we have sick costs, we code it specially or separately so that it's COVID-related sick costs. If there's any additional upstaffing related to COVID, we track that separately, and if there is any overtime incurred related to COVID, we track that as well. And that is the level of detail that we must be able to track and submit to the province. They are looking for, in some cases, photocopies of invoices to be able to ensure that these are definitely COVID-related and incremental costs. So although we've booked this subsidy, there will be a reconciliation report subject to audit by the province of Ontario for all of these expenditures. All that to simply say there are no COVID-related expenses in these financial statements that are being paid for by the property taxpayers of Renfrew County. They are 100% offset in totality. The other thing I'd probably just draw your attention to is we did, of course, have some capital purchases throughout the year. We had a significant capital budget of $1.9 million. We only were able to acquire $720,000 worth of capital equipment items. All of those items, $720,000, are paid for through our capital reserves for paramedic services. So again, those are not levy dollars. We are pulling from prior year capital reserves. There were 2 ambulances that are still in a work in process. They were not actually on the road and available for use at December the 31st. So the chassis that we get have to have Ministry of Health approved lights and sirens and radio packages and decals and et cetera, et cetera. And so those 2 units were not available to be on the road as of December the 31st. We did, however, have 1, 2, 3, I'm not sure what we call them, Chevy Tahoes, emergency management vehicles that we did receive, each of them at $85,188. We had 2 trailers, cargo trailers, delivered at $16,437,000. So we did receive 2 ambulances almost on the road, and that list of trailers and Chevy Tahoe trucks, all of those are paid for via reserves. There are certainly a number of pretty significant over expenditures. I'm just looking at vehicle operation and maintenance is almost $500,000 over budget. Again, the salaries are over budget by $1.9 million, but $800,000 of that was COVID. So about $1.1 million in overspending on the salary account. Just a significant number of these expenditure accounts are over budget, contributing to the $1.2 million over budget position by the County of Renfrew. Just jumping very quickly then to paramedic other, as I mentioned, we separate these programs because the intention of these programs is to be 100% funded by the province of Ontario, and essentially they all were, except in 2022 the long-term care program was the expenditures exceeded the revenues available to us. There was a 3-year funding commitment by the province of Ontario for the long-term care program. We've overexpended those subsidy dollars. And what we did was, you'll see in yellow, about a third of the way down in this group of departments, is that we have a resolution that's coming forward to the Finance Committee tomorrow. It's also in this package as information for the Health Committee. But in the very first year of our VTAC assessment program, we created a billing model based on the number of paramedics that were working at each one of our clinics on a daily basis. Arnprior Regional Health, who was our funding partner for this program early on, was agreeable to that process. And so our actual costs were somewhat less than the billing model that was in place in the first year, and we had a surplus in our VTAC program in year number 1, and Council approved that surplus be tucked into a reserve for future use, rainy day, if you will, specifically and restricted to the community paramedic program. And so the rainy day happened. In 2022, we overexpended the long-term care program by $112,879. So we've dipped into the reserve in order to ensure that we are fully funded in all of our community paramedic programs. And again, some of the announcements that we have made relative to this program is that it is not paid for through the property tax levy in Renfrew County, and so by utilizing these dollars from reserve, we can maintain that position that the property tax levy does not pay for our community paramedic programs, and the use of these reserves ensures that we do that. And then finally, Chair, the very last group the very last department is our emergency management program. So you'll see at the very top line, we have our 911 contract, our Central Emergency Reporting Bureau, CERB, I think it's called. We have a contract with the province for that 911 service at $50,000. We do have an admin charge for a portion of Chief Nolan's time in managing the emergency management program, and so we allocate that through our budget process into emergency management. We also receive from the Renfrew Fire Dispatch Center a bill for fire services charges throughout Renfrew County at $115,000. And you'll see that we have recoveries of $115,000 because we take that bill and we allocate it to all of the local municipalities who are using that fire dispatch service, and there's an agreement in place on how that billing is calculated. We are significantly under budget in the emergency management department, primarily because of the fact that we have a provision of $33,000 for purchase services that we had no expenditures in 2022. And perhaps with that, Chair, I'll just end my review of the draft financial statements.
Thank you, Mr. Foss. Much appreciate. I wonder, Chief, did you wish to comment on any of the items discussed?
Thank you, Mr. Chair. I think the only other item that was a pressure that we had discussed during the budget time was related to actuarial costs for WSIB, you may recall. So that is inherent within the numbers in terms of our payback, if you will, from an actuarial perspective. And I think apart from that, Mr. Foss did an excellent job of overviewing the budget. Thank you for that, Mr. Foss.
Okay, thank you. Questions, comments? Councillor Nicholson.
I just wanted to, Chair, understand a little bit more about the information provided specific to item 7. 2 questions. The the additional funding that was, the billing arrangement led to the operating surplus at the end of 2020, that has no future surpluses forecasted? First question. And the second one is just the community paramedic reserve. What is its current value after we take out 112,000? Thank you.
I'll take a stab. I think the second question, I think there's about 622,000 would remain after the 112 were taken out. I think 738,000 was the actual reserve amount at the start of the year. On the other question, presumably Mr. Foss, could you repeat actually, Councillor Nicholson, the first question?
The surplus that was generated through this billing arrangement, is there forecasted any additional surpluses, or is that just a one-time occurrence?
I will leave that up to Mr. Foss and to Chief Nolan.
Thank you, Chair. So going back to 2020, and of course March of 2020, when the world changed for everybody, the VTAC program was upstaffed on a very rapid basis. The agreement that was not actually in the beginning in writing with Arnprior Regional Health for us to fund our VTAC program. The original billing, and it did, of course, some number of months later, form an agreement in writing. But early on, the agreement was that Arnprior Regional Health would fund $1,000 per day per paramedic and $500 per day for each non-paramedic that was working on our VTAC in our assessment centers. And so that went on from when we upstaffed in March or April right through to the end of the year. So that billing model created a surplus. Our actual costs were not the same as our agreed to billing amounts in the very first year. Come the end of the year, we had a surplus position in our VTAC program, and Council of the Day decided to transfer that surplus into a restricted reserve that could only be used for community paramedic program expenditures in the future. One time only, 1 year only, I should say. The billing model subsequent to 2020 changed to being our actual costs. So we would submit then on a regular basis actual cost reports for salaries, benefits, and any other operating costs to Arnprior Regional Health, and they would bill us actual costs. You'll see in the financial statement summary for 2022, the VTAC Assessment Center program, the dollars that we receive through Arnprior Regional Health are exactly the same as our costs because we are submitting invoices post the end of the month for our actual costs. So this surplus is not expected to ever happen in the future. And I believe the Chair answered the other question, roughly $600,000 available to us, still in that community paramedic reserve.
Follow-up, Councillor Nicholson.
Thank you, Chair. Just come back on the 600,000 that remains in this reserve, the language Mr. Foss used, restricted reserve, specific to community paramedicine, and that encompasses all the whole 600.
Yes, that's correct, and it's $626,004.85.
Thank you, Chair.
Any further comments on the Treasurer's report? I had a couple of questions. And Mr. Foss, Chief, had spoken to one with respect to the vehicle operations and maintenance. I wonder if you could underscore kind of what were the drivers. It's almost a doubling of the cost from a budgeted 504, an overage of 490. I wonder if you could speak to that.
Sure, thank you, Mr. Chair. A significant portion of our vehicle operation and maintenance are the costs related to fuel and diesel, which is, I think, affecting all of us. We've also experienced significant increases in the cost of materials and supplies across the board. And we are also holding on to a fleet longer than anticipated. So because we don't have an influx of new vehicles to replace, as Mr. Foss identified earlier, the cost per vehicle operation is also increasing because we're always trying to find that tipping point of being able to use the vehicle at its lowest cost. And then that's typically also within the regulation in terms of a mileage and time calculation when we excuse those vehicles from our fleet. So as we look at our operating costs, there are a number of things that are in flux, predominantly the fuel costs, but it's very difficult to actually predict what the maintenance costs and parts cost is. I'm sure Councillor Murphy would know that better than most of us in this room. But I think as well, worthy of note, our vehicles have gone from costing us in the range of $200,000 to over $300,000 in the course of 18 months. And while saying that, and that's a difficult enough pill to swallow, then we're feeling fortunate when we're lucky enough to actually receive a vehicle at that higher cost. So we're in uncharted territory, Mr. Chair.
Okay, thank you. And I had assumed that would have been some of it. I will note, pleased, and this has occurred across every department that's showing it, the interest revenue, while certainly where the interest rates have gone, have created some difficulties for the various ratepayers in our communities. But certainly one of the things that we are seeing, the interest earned is about just under 250% of what was budgeted. So certainly the prime rate, and I'm assuming from our conversation at last month's F&A also, the interest on the RAG, the 1.5% less prime, is certainly yielding some extra dollars. There are two specific lines that I wonder, Mr. Foss, if you could just shed some light on. The recovery internal vehicle costs with nothing budgeted, but $250,000 recognized as a revenue, and also revenue other at $547,000 versus a $125,000 budget.
Thank you, Chair. So the two accounts that are in question, so about the middle of the page, we have it ordered alphabetically, so it's paramedic vehicle recovery from other paramedic program. $250,179 represents the cost that has been charged to the community paramedic long-term care program for the use of our ambulance vehicles. And so we originally purchased our vehicles for the 911 program, and instead of disposing some of those vehicles, we held on to them a little bit longer, knowing that the long-term care program was coming our way. And so those vehicles have received, all of the costs for those vehicles remains in the 911 program, and then based on the number of kilometers that are used by our long-term care community paramedic program, we have taken that charge out of the 911 program and moved it down to the community paramedic program. I think the second question is under other. I don't have the details in front of me. I do know that all of our QP recoveries, so for union wages, goes through this account. We also have our agreement with our local hospitals for paramedics that are in the local hospitals, and those recoveries are reflected here. We also have vehicle upstaffing, so when we attend events like Calabogie Motorsports or any of those things, any of those billing agreements comes through the same account, but I don't have any additional details readily available other than those are the nature of the revenues that are reflected in that account.
Okay, thank you. Anyway, just a final comment then. I also wanted to note that notwithstanding that there is a $1.2 million deficit variance, certainly the actual paramedic costs in 2022 are down substantially over just about $1.16 million from 2021. The 2021 actual costs were over $11 million. $11,052,000 to be precise. So certainly want to commend the paramedics for some significant cost containment in the midst of COVID, while we are still wrestling with the challenge of the presumptive and the WSIB, presumptive PTSD and WSIB. So at least pleased to see that the actual costs are diminished substantially over 2021. If there's Mr. Foss.
Thank you, Chair. I thought I'd just pick up on that point. So under employee benefits, paramedic employee benefits, that would be where we charge our premium, if you will, our percentage or burden factor. So for every dollar of paramedic payroll, we have set aside, I think it's 9% as a charge going into our WSIB reserve account, and then all of our bills for actual WSIB costs are coming out of that same account. So as the chair mentioned, in 2021, we had an actuarial review of all of our liabilities, and there was a significant increase in our provision to ensure we had sufficient funds in the future to cover all of our anticipated or expected WSIB costs. Really pleased to say that in 2022, that employee benefit account only had to be adjusted by $180,000 over and above our payroll burden factor to ensure that we hit our WSIB actuarial target for the end of 2022. So that's good news for us. We're not quite there, but we're very close to being to equalizing our funding and our liability accounts. So in total, it's $180,000 of that amount that has been adjusted to ensure we meet our actuarial targets. Thank you.
Thank you, absolutely, Mr. Foss. And I think that perhaps that might go a long way towards explaining the substantial diminishment of the actual 2022 over 2021. You'll note on page 14 here, the employee benefits line for 2022 is $3.15 million, whereas this time last year it was $5.25 million for employee benefits. So I think that that's probably where we are capturing most of that diminishment year over year in the actual expenditures in the paramedic service. Anything further? I'll return to the report then. Back to you for bylaws, Chief Nolan.
Thank you, Mr. Chair. Item number 8, user fee bylaws. Recommendation that Health Committee recommended County Council the user fee for the cost of deploying a paramedic crew for a specific event be increased from $200 to $225 per hour. And the background is that the additional cost for this service is reflecting increases in staff salaries, supply, and fuel, as we just mentioned, and that this fee has not been increased since 2018.
Thank you, Chief Nolan. Can I have a mover, please? Councillor Murphy, seconded by Councillor Nicholson. Any questions, comments? Just one. I just wanted to ensure that this is fully capturing the anticipated hourly costs.
It is, Mr. Chair.
Thank you. Anything further? Seeing none, all in favor? That is carried. Thank you. Back to you, Chief.
Item number 9, a recommendation that Health Committee recommend that County Council adopt a bylaw authorizing the Warden and CAO Clerk to sign the lease agreement and letter of agreement between the County of Renfrew and Care for Health and Community Services to lease office space at 425 Cecilia Street, Pembroke, Tennessee for the RC VTAC program for a period of 1 year, and that is from April 1st, 2023 to March 31st, 2024. Background. Sorry, Mr. Chair, would you like me to cover the background?
Carry on, please. Yeah.
And the background that the initial lease for the office space limited to 2 months based on provincial funding for RC VTAC expired on March 30th, 2023. On March 24th, 2023, permanent funding was announced by MPP Yakabuski for RC VTAC, and as a result, the lease is being extended for a period of 1 year from April 1, 2023 to March 31, 2024.
Thank you. Could I have a mover, please? Councillor Yon, seconded by Councillor Purcell. Any questions, comments? Seeing none, all in favor? That is carried. Thank you. I'd now seek a motion to accept the Emergency Services Report, please. Councillor Purcell, seconded by Councillor Nicholson. Final opportunity. Any questions on any of the items? All in favor? That is carried. Thank you. With that, we will go directly into the long-term care report. You will find that beginning on page 16 of your package. And I invite Mr. Blackmore, please take us through it.
Thank you, Chair Donahue. Good morning to you and to committee members. Item number 1 details significant loosening of the COVID-19 infection prevention control measures as the respiratory season winds down and COVID levels in the community plateau. The revisions took place on April 1st, 2023. The most significant of those loosening of restrictions includes moving to a passive screening and foregoing the need for a rapid antigen test on entry into the building. Further to moving toward normalcy where resident quality of life is concerned, there's other significant reductions with regard to visitor restrictions as well. The province also announced to homes that they should take a look at their vaccination policies in terms of revoking. And county committee will recall that county homes lifted their vaccination policies for COVID-19 on March 1st. Essential caregiver status remains intact, and what that is it allows the essential caregiver to be able to visit during times of outbreak to give care to residents on affected units. An update for both homes, so just with these announcements coming into effect on April 1st. On April 10th, the Renfrew County and District Health Unit declared a COVID outbreak at Bonnechere Manor on HM1 South. On April 10th, Renfrew County District Health Unit also declared a confirmed outbreak at Miramichi Lodge on resident home areas 2B and 3B. So contact precautions remain in place. And just a reminder to committee that we're fortunate that the greater majority of our residents are current with regard to their booster status. Item number 2 concerns a wide variety of funding announcements that came via the Ontario provincial budget, announced on March 24th. And typically, with regard to the detail for each home will receive a report from the ministry identifying just what funds are coming our way with regard to the numerous items that are listed. Such as wage enhancement, professional growth funds, behavioral support, Ontario support, and direct care funding. And also they're announcing more funds for nurse practitioners, but committee will recall that both homes are fortunate to have now have an NP, an employee, with the recent hire of a nurse practitioner at Bonnechere Manor. Item number 3. It confirms the anticipated termination of the COVID-19 Infection Prevention and Control Fund, terminated April 1st. Along with that, we received notice from the ministry that expenditures for IPAC up until December 31st that were over that which was anticipated for both homes will be covered. The amount of totaling $831,349 for Bonnechere Manor and $606,724 for Miramichi Lodge. Item number 4 is the long-term care's homes level of care per diem summary. So it's essentially what this box it outlines the funds to be received by each home, assuming a CMI or case mix index of 1.0. Committee will recall that during our budget exercise, we anticipate, at the time it was announced by the ministry that CMI was frozen. The sector lobbied quite heavily to have current CMI levels be considered for funding, and I think as a result of that, the ministry had reversed its decision, identifying that CMI was no longer frozen, which resulted in a loss of funding for Miramichi Lodge of $154,754 and an increase in funding for Bonashire Manor as a result of their CMI being higher than the frozen amount for $52,965. Item number 5, Chair, I'm not sure what, it's a presentation I'd like to do with regard to Accreditation Canada. Do you want me to say that for the end, or?
Sorry, just let me go back to my agenda here. How many more items? Maybe before we get into resolutions, we'll finish the information items. I'll bounce over that, or maybe we'll do that at the end of the information items, and then we'll review them. So we can just hold that over. We'll carry through the rest of them, and then if you can come back to that.
Okay. Continuing on, number 6, another information item is the Ministry of Long-Term Care inspection for Miramichi Lodge. This summarizes the inspection that was conducted by 6 ministry inspectors, beginning on January 4th and ending on February 6th. The inspection was primarily in follow-up to 12 critical incidents that were reported to the ministry. So critical incidents essentially are any number of things that we are required to report to the ministry, be it an alleged abuse and medication error resulting in an injury, falls, things like this. So these are the things that we're required to report, and what the ministry tends to do, depending on the severity, they'll kind of wait till there's a critical mass of them, and then they'll appear at the home to follow up on the various reports that are submitted. So again, 10 critical incidents, as well as 4 complaints that were received. The home received 5 written notices. So the written notice, in terms of the scale of what you may receive for a non-compliance item, is the base level. One could also receive a written notice requiring a verbal plan of correction, a compliance order, a fine, or referral to the director are basically the steps. So again, written notice is the baseline. No injury or untoward outcome is attributed to any of the findings, and the report is linked within your report. And next is resolutions.
I think we'll pause there then, Mr. Blackmore, and we'll go back, returning to page 16, committee information item number 1, the COVID-19 directive update. Any questions, comments? Item 2, the Ontario budget 2023-24. Item 3, COVID-19 prevention and containment funding. Councillor Nicholson.
Thanks, Chair. Just a question. When I looked at the Bonashire Manor versus the Miramichi Lodge, just in the table that was provided, are those proportional to the expenses, or why is there $230,000 difference between the 2 expenses over that time period?
Mr. Blackmore, please.
Through Chair to Councillor Nicholson. So they're directly related to expenditures. So basically, it's whatever we spent that we've coded to IPAC containment, whether that be supplemental costs for staffing agency at one home versus the other, or a particular piece of equipment that's required at one home versus the other. So if it fits within the criteria established to apply the funding, where there was a need, we applied the funding, and we received 100% of the funding back.
Thank you, Chair. I just was curious if there's any pattern why one was higher than the other. But if it's just a matter of these are the expenses, then these were. I understand. Thank you.
Thank you.
Thank you. Anything further on item 3? Item 4, the long-term care homes level of care per diem funding. Councillor Murphy, please.
Thank you, Chair. I think at AMO this year, this is probably, once again, a delegation we should ask for from Minister Calandra. We know the CMI is not working. There doesn't seem to be any rhyme or reason to it. And Mr. Foss will giggle at this, much like the Municipal Partnership Fund calculation that nobody can understand. I think that, perhaps if at County Council, we could ask the warden if this could be one of the delegations with the minister at AMO. Thank you.
Thank you, Councillor Murphy. I'm assuming that we will probably have at an upcoming council meeting, Mr. Kelly, much as we did for Roma, where we are bringing forward recommendations on delegation requests.
To you, Chair, that's likely correct. AMO's in August, obviously. I suspect by May or June they'll start asking for those requests, so we'll put that on the list of possibilities.
Thank you. Anything further on item 4? Item 5 is the presentation. We'll jump right over to item 6. Any questions, comments on the inspection? Councillor Nicholson.
Yeah, thank you, Chair. I just wanted, I appreciate the detail that was provided in that licensee inspection report. It was really interesting to see the types of things that are being dealt with. I'm just curious, the pattern, over that time period, there was 12 complaints or, I can't remember the second way it was described, but is that typically what happens over a quarter, receiving about 12 complaints between the two homes over a quarter, or can we amplify anything on that?
Mr. Blackmore, please.
Through you, Chair, to Councillor Nicholson. I'll have to look back, but it's beyond even a quarter. I mean, sometimes we get follow-up on reports that are a year old. Yeah, there's no real pattern. Like I say, that the delicate part here is if there's an utterance of an alleged abuse, even at being at the alleged stage, it's a report. Even if, when it's determined, most times to be unfounded. I mean, there are occasions where it is founded, but quite often not. It still appears as a critical incident report that requires follow-up.
Thank you. Anything further on item 6 rather, sorry. Seeing none, I wonder now, Mr. Blackmore, if you wanted to make your presentation on the accreditation Canada.
Thank you, Chair.
Also, just before you do, I just consulted briefly with Mr. Kelly. When we conclude this, I think we'll kind of amend the order so that before, much like with emergency services, we'll review the financials. You will note yesterday there was an addendum sent out by Ms. Gruntz that contained the financial information for each of the lodge and the manor. I think as we did with the emergency services, before we get into resolutions, we will address those as well. But the presentation now, please, Mr. Blackmore.
Thank you, Chair Donohue. With your indulgence, I've put a PowerPoint slide up. You'll recall that committee was requested to complete a survey, and my apologies for the screen size. What I've done is I've basically captured the results of our survey. And what I thought I'd do is kind of go through each question, identify where we lined up in terms of the score, and then address any shortfalls that came about from the survey that require us to get an action plan to get us back into compliance when the survey actually occurs come June, I think it's June 24th, at which time myself, the chair of the health committee, the warden, CAO, will meet with Accreditation Canada to review the governance survey. So Tina, if I could move to the next slide. So bear with me, I'll read through the questions if I could. So the first one asks us to rate the roles, responsibilities, and legal obligations of the governing body are defined and regularly reviewed, which we scored a 100% compliance. So just things that cover that off for us is that we're adherent to the Long-Term Care Homes Act. We signed long-term care service accountability agreements for both homes, as well as a multi-sector accountability agreement for Bonnechere Manor, and we adhere to the Municipal Act. The second question asked, there are established mechanisms in place for the governing body to hear from and incorporate the voice and opinions of residents, families, and caregivers. We responded as 83% with met and a 17% did not know. This is an on-site survey question. So we do issue on an annual basis resident satisfaction surveys, for which they're included in our health committee minutes and subsequently passed on to county council. We've established resident and family councils at both homes, resident and family council at Miramichi Lodge. We did have a family council established at the Manor. It had dissolved. We're in the process of trying to get it up and running again. But we do have a resident council that sits at Bonnechere Manor, for which the Director of Long-Term Care and the Administrator meet directly with those committees. 1.13, the statement, the governing body has processes in place to oversee the functions of audit and finance, quality and safety, and talent management. So we scored about 100%. We do go through the exercise of putting together an annual budget, a workshop that's completed with Health Committee and senior leadership, and presented to County Council for approval. Again, we enter into long-term care service accountability agreements and multi-sector service agreements with the province for both homes. We issue quarterly variance reports to Health Committee for review, and that's presented to Council as well. And of course, this is a public meeting that we do, and we broadcast via YouTube. In terms of talent management and safety, the Health Committee report will be inclusive of quality items, and you'll see that coming up as an action plan. On an annual basis, we do submit the quality improvement plan that's put forth by committee and signed off by Council and forwarded to the province. All the senior management team, including the CAO, are held to annual performance appraisals, for which items such as the finance, quality and safety, and talent management are considered. Next slide, please. 1.14, the governing body provides oversight of the organization's efforts to build meaningful partnerships with residents, families, and caregivers. So again, we rate it 100%. We do engage in annual resident satisfaction survey. We submit the quality improvement plan on an annual basis, and there are plans coming up I'll get into about maybe including quality as a quarterly item for Health Committee. The Director of Long-Term Care and Administrators liaisons with both resident and family councils. Our compliance inspection reports are shared with committee and council and resident and family councils as well. And again, our meetings are public and available over YouTube as well. 1.15, the governing body monitors and evaluates the organization's initiatives to build and maintain a culture of people-centered care. The rating was 100%. So committee will recall it's been on hold for some time, but we're up and running with meetings this coming week with Meaningful Care Matters to engage the butterfly model of care for both homes. And person-centered care is included in the home's operational plans, has been. 1.16, the governing body oversees the recruitment and selection of the executive leader of the organization. So at the CAO level, recruitment and selection is completed with participation from elected officials. Myself was recruited by an interview panel consistent of Health Committee representation, warden, senior leadership team, human resources, and the CAO. Next page, please. 1.17, in partnership with the executive leader of the organization, the governing body sets performance objectives of the executive leader and reviews them annually. We had an NA at 17% and a MET at 83%, and indicated that performance objectives are tied to home and corporate strategic plan and the home's operational plan. The committee council representatives meet with the CAO for his annual performance appraisal. CAO has an annual performance appraisal performed, and my annual performance appraisal is tied to these same objectives as well through the CAO. 1.18, the governing body has a mechanism in place to receive updates or reports from the executive leader of the organization. So we do, obviously, the health committee meets at minimum 10 times per year. Our reports are public. They're forwarded on to county council for review and approval. So, I mean, yeah, I mean, that's the mechanism of ensuring compliance and that it's recorded. 1.19, the governing body approves the organization's capital and operating budgets. So capital and operating budgets are developed per long-term care departments for submission to health committee via workshop, and then refined at the workshop for presentation to county council, who has ultimate approval. Next page, 1.1.10. When approving resource allocation decisions, the governing body evaluates the impact of the decision on quality, safety, and resident experience. We rated at 100%. Impact to care delivery in terms of staffing levels are considered paramount to care quality and safety and resident experience. Funding is tied to care acuity. And the County of Renfrew provides additional funding over and above that provided by the province. 1.1.11, the governing body monitors organizational level measures of resident safety. All matters of resident safety resulting in critical incidents are reported formally to Health Committee and Council. Annual quality improvement plan prioritizes resident safety indicators and are presented to Committee and Council for approval and made available to the public. And identified policies enacted for council approval are enacted as required by way of example, our recent COVID-19 vaccination policy. 1.1.12, the governing body regularly hears about quality and safety incidents from the residents, families, and caregivers that experience them. We had an 83% met and a 17% unmet. All resident critical incidents are submitted, whether alleged or actual, and they are disclosed at Health Committee and Council and are reported publicly, reported to the resident councils and family councils. And action plans are initiated to remedy immediately. And we'll get into in the action plan further with regard to the deficit, with regard to, I think we can make improvements to the frequency for which we report quality as a standing agenda item. 1.1.13, the governing body demonstrates accountability for the quality of care provided by the organization. And this is what's called an ROP, or required organizational practice, for which all standards must be met to achieve compliance. In a test for compliance, 1.1.13.1, the governing body is knowledgeable about quality, safety principles by recruiting members with this knowledge or providing access to education. And we had a 70% NA and 83% met. By way of example, the director of long-term care, administrator, and management teams possess required expertise and training specific to quality and safety principles. Safety and quality are performance measures as set out in home operational plans. 1.1.13.2, quality is a standing agenda item at all regular meetings of the governing body. So at present, this was scored at 50% unmet, 33% met. So at present, the QIP appears as an annual agenda item. So once a year, we're required to submit the QIP. So we're covered once a year. But as we'll get into in subsequent slides, an action plan to beef up that frequency. 1.1.13.3, the key system level indicators to be used for monitoring the quality performance of the organization are identified. So we scored 100%. Indicators such as occupancy and wait lists and deaths and discharges are reviewed quarterly at Health Committee and forwarded on to County Council. Key system level indicators are set out in the quality improvement plans as submitted to the province for each home. Annual satisfaction surveys are conducted and responded to as part of the operational plan. 1.1.13.4, at least quarterly, the quality performance of the organization is monitored and evaluated against agreed-upon goals and objectives. And as indicated at present, the QUIP is an annual report, and we will, in the action plan, we'll talk about how we can move that up to quarterly. So yeah, that was 33% unmet, a 17% don't know, and a 50% met rating. 1.1.13.5, information about quality performance of the organization is used to make resource allocation decisions and to set priorities and expectations. 33% unmet, 70% don't know, and 50% met. And again, at present, the quality improvement plan is only an annual report, and we'll get into action plans in the next slides. 1.1.13.6, as part of their performance evaluation, leaders who report directly to the governing body, example CEO, executive director, or chief of staff, are held accountable for the quality performance of the organization. So the CAO, director of long-term care, receive annual PAs tied to quality performance. 1.1.14, the governing body publicly discloses information about its governance process, decision-making, and performance. We scored 100%. All health committee meetings and health committee reports presented at county council are matters of public record, streamed and recorded on YouTube as well. So for the deficits that were identified in our survey, it's just me kind of spitballing here for your feedback. So 1.1.12, the governing body regularly hears about quality and safety incidents to the residents, families, and/or caregivers that experience them. A thought to 1, continue committee and council review of annual resident and family satisfaction surveys and critical incident report summary reports. 2, continue efforts to reestablish the Bonnechere Manor Family Council and host quarterly information sessions to do so. And 3, Director of Long-Term Care to seek quarterly resident and family councils feedback specific to quality and safety incidents via resident and family councils and reports to Health Committee. Next is 1.1.13.2, quality is a standing agenda item at all regular meetings of governing body. And 1.1.13.4, at least quarterly, the quality performance of the organization is monitored and evaluated against agreed upon goals and objectives. Plan to expand annual health committee review, county council approval of the quality improvement plan to include quarterly progress review of QUIP indicators for both homes. The QUIP indicators for Bonnechere Manor are about percentages of emergency department visits for modified list of ambulatory care, sensitive conditions per 100 long-term residents. Number 2 is a percentage of residents with a pressure ulcer that worsened since previous assessment. Number 3 is percentage of residents who fell during the 30 days preceding their assessment. So that's the QUIP for Bonnechere Manor. And basically repeating for the Miramichi Lodge, the differences being the indicators for Miramichi Lodge are 1, percentage of emergency department visits modified for modified list of ambulatory care sensitive conditions per 100 long-term care residents, percentage of residents with a pressure ulcer that worsened since previous assessment, and the percentage of residents who were given antipsychotic medication without psychosis in the 7 days preceding their resident assessment. So these are indicators that were identified to be priorities from the province of Ontario, not all, but some, certainly the antipsychotics and emergency department visits, and the others are specific to areas requiring improvement at either home. The next slide is the standard 1.1.13.5. Information about the quality performance of the organization is used to make resource allocation decisions and set priorities and expectations. And the plan is to implementation of quality improvement as a quarterly health committee standing agenda item to serve as a factor influencing resource allocation decisions. And that's my presentation. I'd be pleased to entertain any questions.
Thank you, Mr. Blackmore. So that is item number 5. Any questions or comments on the survey? Councillor Nicholson, please.
Chair, I just wanted to say that I thought the process was really good to go through that questionnaire. It forced me to think about how I read that and what those standards meant to me. And then this explanation was an excellent way to wrap that up. So I appreciate the approach, and I would encourage it especially with new councillors, that this be something that's repeated. Thank you.
Thank you. Anything further? Okay, as noted, I think that we'll address what is actually item number 11, but we're going to advance it into the information items. Excuse me. You will note just before noon yesterday, Ms. Grunts had distributed an addendum, which is the financials for both the lodge and the manor. So I would invite Mr. Foss once again to take us through those year-end financials, please.
Thank you very much, Chair. And referencing that appendix that went out, the first group of unaudited and draft financial statements for 2022 are for Bonnechere Manor. I'd actually ask you, if you would, just turn your attention to page number 6, which is our revenue page for Bonnechere Manor. And I'd maybe like to begin just our discussion there. So on page number 6, you will note toward the bottom of the page, the grand total of all revenues for Bonnechere Manor are $19,322,000. Bonnechere Manor is reporting an actual surplus of $416,000, so roughly 2%. So it's a fairly slim margin for a big organization, a large long-term care facility with 250 or 300 staff, and certainly also coping with COVID-related issues throughout 2022. So certainly an excellent job by Michael and his team at managing with the funds that were provided to him for the 2022 fiscal period. At the very top of that page, you'll see municipal subsidy. So in Renfrew County, of course, we support with municipal tax levy dollars both of our long-term care facilities. Similar to many other departments in the 2022 budget year, Council approved a 2.5% increase over the 2021 budget period. And so you'll see that our budget and actual for municipal subsidy is essentially bang on. So Michael and his team understands that he's got $2.2 million of city and county money coming into his facility to support the province of Ontario per diem funding for the facility. How do we determine the cost share for the county and the city of Pembroke? Well, that goes back originally to an agreement that was established in 1971. And the agreement is essentially based on resident census at the end of each fiscal year. So on December the 31st of each year, we actually take a census of who are the residents in our long-term care facilities and whether those residents came from the city of Pembroke or whether they came from elsewhere in the county of Renfrew. And based on that census, we apportion the municipal cost to either the county or the city of Pembroke. Just want to note for you the labels that say County of Renfrew and City of Pembroke. Those labels are not correct. The actual amount is actually 67% for the County of Renfrew and 33% for the City of Pembroke, and that is what the actual calculation is based on. We just haven't updated those labels, but we will when we get to the final set of financial statements as opposed to the draft. A couple of years ago, we amended that 1971 agreement with a supplement, if you will, a new 5-year agreement that would be based on a 10-year rolling average. And for those council members who have been here for some number of years, taking a census of the residents on the last day of the year created some peaks and valleys for us. So our cost share increased to above 70% some years and then dropped down to about 60% in other years. And that peak and valley was very difficult from a budgeting point of view to ensure that we didn't really have some unfavorable positions in some year and favorables in others. The City of Pembroke felt the same, and so we entered into a new agreement which started in 2016, and we will then be using up to a 10-year rolling average. We're not quite there yet, but the 10-year rolling average for the 22 fiscal year was actually 32.64%, and we used 33% for the purpose of budgeting, and so that's kind of where we're at. But that's how we apportion the cost between the county and the city. The next group of accounts is resident revenue, and so each resident in a long-term care facility pays a portion of their accommodation fees. There is a minimum established by the province of Ontario, and so that fee is required from each resident based on their income. And if residents don't have sufficient income to cover their basic fee, the province of Ontario, through their provincial subsidy, will supplement that to guarantee that Mike and his team has a standard fee for each day for each resident in the facility. So that's where that basic accommodation comes from. We set a budget based on last year's actuals, and it may be up or down from that amount, but we're guaranteed our budgeted amount based on the combination of basic accommodation and provincial subsidy. What's really notable in this particular section of accounts is preferred accommodation, and especially preferred accommodation for high-intensity need claims. The funding agreement with the province is that for each private or semi-private room, we can charge a daily preferred accommodation amount, so those residents enjoy some additional privacy, if you will, through a preferred accommodation, and that amount we get to keep. So that $458,000 is ours. We don't have to use that as part of any cost-sharing agreement. That is funds that the facility can use as they choose. The $111,000 that we don't anticipate through the budget process was a bit of a windfall for Bonnechere Manor, and that's preferred accommodation for high-intensity need claims. So we do have some residents in our facilities who require additional and special care, high-intensity care. They are occupying preferred accommodation rooms, but they are not paying the daily preferred accommodation. They are basic fee residents, but because of their medical situation, they are located in a preferred accommodation room, and the province of Ontario supports that. They pay us the missing fees because they are occupying that preferred accommodation room. So we didn't budget for, but we received $111,000 in those fees, which was certainly a good news story for Mike and his team at Bonnechere Manor. Underneath other revenue, the big standout, of course, is interest income. We are budgeting interest income based on prior year experiences, and in 2022, as we're all aware, the Bank of Canada raised the bank prime 7 times throughout the year, and so our banking agreement follows bank prime. We earn bank prime less 1.5% on every dollar that sits in our accounts on a daily basis, and so we enjoyed, in this situation, a boost in our interest income in the 2022 period. Next, we get under grants and subsidies, and there's a couple of complicated things here, so I'll try not to get too detailed, but the very top line item, federal ICIP, $769,000, that is being used to fund a pretty significant HVAC program at Bonnechere Manor. We applied for federal funds to upgrade our HVAC facilities in Bonnechere Manor, and we spent in our capital program $769,000 on this project in 2022, and all of that capital work is being fully funded through this federal ICIP program. Next to that, we have 2 other items with large budgets to them. These we call provincial revenue 4-hour of care per day funding envelopes. These were new funding envelopes introduced to us. I think 2021 was the very first year, And essentially what the province wants to do, and they made a commitment to ensure that every long-term care facility is able to meet a minimum of 4 hours of direct care per resident per day. And recognizing that that's going to take some investment, the province made available to Bonnechere Manor for direct care nursing $1.2 million. And in addition, $244,000 in allied health professional, which are not direct nursing care, but they are allied health costs, physiotherapy costs, or social worker costs. And so what we did in the budget is we reflected all of the money that was available to us, being $1.2 million and $244,000, and in our salary budgets in nursing and in client programs, we increased the budgets. We can't benefit from this program. We have to spend the money on increased hours of staffing in order to qualify to get the money. So we did qualify for a little bit, $166,000 of direct care nursing. We didn't qualify for all of the $1.2 million, but that's all we spent. So it's a net zero impact to us. Everything that we paid, we were able to claim against this program. But the good news is that in 2021, we couldn't claim anything because we couldn't increase our staffing from where it was sort of in pre-COVID era, if you will, before the program began. So that's a qualification process, and so we were able to qualify for a portion of that funding. About halfway down the grants and subsidy, you'll see a whole bunch of provincial revenue accounts that are labeled COVID. And once again, we, in 2022, were supported in all of our COVID activities. If you add up all of those accounts, it adds up to $1,734,000, and those are dollars that we had to spend on either COVID prevention or mitigation strategies, and then we could claim against this funding in our homes for COVID support. Of note, and Michael identified this earlier today, COVID is coming to an end. At least COVID funding is coming to an end. So although they funded us in 2022, and although they have announced that up to March the 31st, there will be some support for COVID mitigation and prevention, that will all come to a crashing halt. So effective April the 1st, any COVID related tail costs that we have will be borne by us, the municipality of the Corporation of the County of Renfrew. So we have to be very, very careful from here on in about any incremental spending that we have on COVID, because there is no financial support from the province of Ontario. That's not just long-term care, that's the same for paramedic services and for all of our other divisions across the corporation. So that's really just a note for committee to be aware that any COVID-related costs that we experience, 100% of them are covered by the provincial COVID support programs in 2022. No property taxpayer levy dollars were spent on COVID support in 2022 in either Bonnechere Manor or Miramichi Lodge. And at the bottom of the page, you'll see a surplus adjustment transfer from reserves. From a budget point of view, all of our capital spending, we intend to offset it through transfers from reserves to pay for our capital spending. So what I'll just let you know is on this line item, we are significantly above our budget, but so is our capital program significantly above our budget. We spent $1.6 million in capital. $640,000 is being paid for via reserves. That leaves us a difference of $975,000, which is being paid for through that $769,000 federal ISIP program that I talked about, the HVAC program. There's a small IPAC capital component of $18,000. We had $93,000 of lifts that were funded through COVID. $25,000 through the Municipal Modernization Fund for some information technology capital items. I think, Chair, I don't know if I'll go into a lot of details. I thought what I'd try and do is just kind of focus primarily on the funding sources and our net surplus position for Bonnechere Manor. Perhaps what I could do is just jump to Miramichi Lodge and do a similar overview, and then we could open it up to some questions.
Sure, I think that's appropriate.
So Miramichi Lodge, also in your package, if committee could turn to the very last page, and perhaps we'll start, it's actually page number 12, and similarly we'll go through the funding sources for Miramichi Lodge. Again, at the very top of the page is municipal subsidy, so similar to Bonnechere Manor. We budgeted and we are supporting Miramichi Lodge with $1,849,000 of municipal tax levy dollars, in addition to all of the other provincial subsidies and funds that we receive, and that's exactly equal to the budget. Again, Council approved a 2.5% increase in 2022 for Miramichi Lodge over the 2021 period, and that is reflected in the municipal subsidy line. And again, the cost share for the city and the county is on the same basis. We use that 10-year rolling average of resident in our home as at December the 31st. Resident revenues, you'll see preferred accommodation. Again, we get to keep all of that money at Miramichi Lodge, $723,000, significantly more than it is at Bonnechere Manor, but we have more preferred accommodation rooms at Miramichi Lodge than we do at Bonnechere Manor. And similarly, the high-intensity need claims, preferred accommodation for those individuals occupying those rooms supported by the province, but nowhere near what it was at Bonnechere Manor at only $29,000. Other revenue for interest income on the cash available to Miramichi Lodge, again, budgeted 30 based on prior year, and Bank Prime jumping as it did, we experienced $103,000 in bank in interest revenue for the 2022 year. Under the grants and subsidy program, again, very similar to Bonnechere Manor, we budgeted for $1.1 million in the nursing staff supplement because that's the maximum amount that was available to us, and we increased our staffing budget in nursing by that offsetting $1.19 million, expecting to hopefully use all of it. This committee will be certainly very aware of the challenges that we all face in healthcare in attempting to recruit and retain staff. If it was easy, I guess everybody would do it, right, Mike? But it's not that easy to recruit and retain our staff in our long-term care facilities. We were able to increase our total staffing hours from the pre-COVID, if you will, until December of 2022 to the tune of $167,000, but that's all of the money that we could use. And again, Miramichi Lodge could not use any of this fund in 2021. We simply could not increase our staff, and as Mike will and has probably shared with this committee, very often we are working on a shortage position because we cannot fill all of the shifts in all of our homes all the time. Similar to Bonnechere Manor, there's a group of accounts that are all labeled COVID, and we have $2,031,000 in total COVID expenditures that are throughout the financial statements. And so those costs, again, are 100% offset by provincial COVID-related funds available to us. All of that ends March the 31st and no longer available to us. Similarly, we use some reserves, capital reserves. We had a capital program of $846,000 for Miramichi Lodge. We funded that with $207,000 through reserves. In addition to that, We used $25,000 from municipal modernization funds for some IT equipment, $400,000 from COVID funding, and $141,000 from IPAC minor equipment funding to support our entire $846,000 balance. Unlike Bonnechere Manor, Miramichi Lodge is reflecting a small surplus. It's almost offset with the surplus was in Bonnechere Manor. There's a deficit in Miramichi Lodge of $487,000 against their total expenditures of just over $18 million, so roughly 2%. As a deficit position. So between the two homes, we're essentially coming out on a break-even basis. But again, very large $18 million budgets. The majority of our staff that work for the County of Renfrew work in the long-term care environment. It's a mix of full-time and part-time staff. And Bonnechere Manor has, in addition to that, has leaned fairly heavily on some of our third-party staffing agreements to be able to have third-party nurses working for us in Bonnechere Manor when we didn't have staff available in the 2022 year. And so certainly my hat's off to Mike and his team for managing a very difficult year and coming out with being very close to the $0 excess or deficit based on budget. Maybe I'll just stop my comments there, Chair, and open the floor for some questions.
Thank you very much, Mr. Foss. Once again, very comprehensive. Is there anything, Mr. Blackmore, that you wish to speak to directly?
Thank you, Chair. Just with regard to the challenges, specific to recruiting. So with that $1 million unspent, as it were, in staffing, but we did still manage to bring our staffing levels up to the high, with the additional hours we've added, to the highest levels we've been with regard to PSWs on the floor. We continue to endeavor to improve that, but there is an overall improvement from our baseline staffing.
Okay, thank you. Now, committee, with respect to either of the lodge or the manor, any questions, comments? Councillor Purcell.
Thank you, Chair. I guess just getting back to the discussion in regards to the COVID subsidies and retention. The PSW wage enhancement and the RN, RPN retention payments would actually be the fallout once those dollars disappear as of next year in terms of staffing.
Mr. Blackmore.
Thank you, Chair. Through to the councillor. It's the PSW wage enhancement is permanent. The RPN, that was a one-off. I forget what it was, a dollar amount versus an hourly wage.
Follow-up, Councillor Purcell.
Thank you, Chair. So I presume then we're looking at a significant budget increase to maintain those salaries next year.
Through Chair to the council, the wage enhancement, we received those funds from the province for $3.
So it's not just specifically under COVID. I just see it here under COVID. PSW wage enhancements is $500,000.
Yeah, it's a recent announcement. It's been made permanent. We'll receive that $3 subsidy from the province going forward.
Mr. Foss, perhaps you can weigh in.
Thank you, Chair, and that's exactly what I was going to say was a number of these programs were introduced sort of in the 2021 and then again in 2022. Certainly all long-term care homes were struggling with the ability to staff the facilities, and you may recall just generally in the news the Premier making announcements about ensuring that we compensated these frontline staff. It was a province-wide retention initiative, but it originated during COVID, during the pandemic. Now that we are reaching sort of post-pandemic times, the province made a recent announcement that this $3 an hour wage enhancement only for the PSW group will be embedded as a permanent funding support mechanism. So we will no longer be reflecting it as a COVID line item. I suspect it will be embedded as part of our general provincial subsidy accounts. But it's the dollars that we received, we have to spend those dollars. So again, we have to make a subsidy claim based on the hourly wage and how many hours of PSW care are in our home, and we can claim for those hours. The other subsidy programs, the RPM programs, those are all ending. Those were sort of a $2,500, I think, lump sum payment to ensure that nurses who were working in March of the year were still there in September of the year, and if they did, we could qualify for this lump sum $2,500 payment, but those are disappearing. So we're not going to really be harmed or helped by the PSW premium. We have to spend it in order to claim the subsidy. There's no leftover for us, if you will. Thank you.
So if I'm understanding correctly, the outside of the PSW, these were not structural changes. They were akin to perhaps one-off COVID pay and returned to base rates of whatever the collective agreements are with various unions at both Miramichi and Bonnechere. Anything further? Just one question that I had, Mr. Foss. I just note that in the there is a breakdown for it may not be in today's presentation, but it's for F&A, where it is describing or capturing the COVID costs, substantial, maybe $4.5–5 million, something on that order. But I do note that there is still a reserve in the safe restart, something on the order of $1.7 million. And is that anticipated to still be available to offset some COVID costs in 2023?
Thank you for the question, Chair. We did receive, via the federal government, a transfer of funds, Federal Safe Start Program. In total, I think there was several transfers, about $3.2 million that came at the beginning of the pandemic. But unlike many of our provincial COVID subsidy programs, this allocation, I have no idea what it was based on or how they determined our amount. Population-based, could be, kind of forget even if there was any details. But we have set those funds aside into a reserve. The letter that accompanied these funds was that they were restricted and could only be used for COVID prevention and mitigation costs. And we do use some of those funds, or we have used some of those funds, for our departments experiencing COVID costs that don't have provincially supported COVID programs. So as the Chair mentioned, for example, in our HR department, we added some additional resources to our employee health coordinator, who was overwhelmed by the multitude of COVID-related sick applications. And so we had some additional nursing resources that would supplement her activities. So her salary was covered in a base budget and has been for many, many years as an employee health coordinator, but those incremental hours, those part-time hours that we spent to support her activities for COVID mitigation, we have applied to the Federal Safe Start Program to support those additional costs. But they are COVID incremental costs. We never would have occurred them had COVID as a pandemic not been upon us. So there are dollars that remain in that Federal Safe Start Reserve at the end of the year. We have had no information, no communication, no correspondence on that fund, whether they will ask for an accounting of that and have that repaid, or if those funds can remain with the County of Renfrew. So to date, we have used them for COVID incremental costs only, and they remain in a reserve fund to be repaid back to the federal government should they ask for it. Or if we still have COVID costs moving into 2023 and they are eligible costs, we will continue to use that fund to support COVID costs unless the federal government calls me and says, I want them back. I suspect, like all COVID programs, there will be a full accounting subject to federal audit for every dollar that we spend out of that fund. And so we guard it fairly closely, and we only spend that on what we feel are legitimate COVID incremental costs. Thank you.
Thank you. One thing, actually, I also meant to address when we were receiving the financial statements for the Emergency Services Department. While it is certainly true that the Corporation of the County of Renfrew has been kept whole with respect to COVID expenses, there certainly has been some of the levy dollars have been expended on COVID. I will note through this committee, Public Health has funded Renfrew County District Health Unit in 2022. That was $1.73 million. I don't know yet. The financial statements will not yet be completed for the 2022 year at RCDHU, but coming out of 2021, the funding that the obligated municipalities provide to public health goes towards what is referred to as the mandatory programs, i.e. Small water systems, inspections of restaurants, et cetera. And those were substantially reduced through COVID. I think, if memory serves, through 2021, almost half of the funds were diverted towards COVID. And only once those funds were expended, then there were extraordinary COVID funds that were available from the province. But it should be noted that through the levy provided to public health, to Renfrew County District Health Unit, the City of Pembroke, Township of South Algonquin, and the County of Renfrew did in fact utilize levy dollars towards the engagement of the COVID pandemic. This is just for a little bit of clarity. Anything further and final on the financial statements for the two long-term care homes? I'm seeing none, so we will return then, Mr. Blackmore, to your report. You will bear with me. I cannot recall what number we were at. 8, I think, perhaps? 7. We will return to 7, please, Mr. Blackmore.
Thank you, Chair. Through to committee. 7 being a resolution. Recommendation that the Health Committee approves the County of Renfrew Long-Term Care Homes 2023 operational plan. Shall I give background?
Please. And read the recommendation as well, please. You had. Thank you.
Sorry.
That was it. That was not the title of this. That was the recommendation. Thank you.
So as
background, please, Mr. Blackmore.
So as background, I'm going to give an overview of the 2023 operational plan. Sorry, the background gives an overview of the 2023 operational plan. In keeping with the 2017-2024 strategic plan that was created with input from relevant stakeholders, so family, resident council, family council, staff. The plan is influenced by a combination of Accreditation Canada recommendations, compliance inspection reports, regulations, and mandated quality improvement initiatives and feedback from residents and family. The plan is framed by 3 strategic pillars that was identified early on in the strategic plan, that being innovation and quality improvement, safe and healthy workplace, and collaboration. And it is attached as Appendix Long-Term Care 1, beginning on page 22 of your report. The 2022 Resident Satisfaction Survey is attached as Appendix Long-Term Care 2. And overall, the survey responses were very positive, but as one might expect, there were some suggestions or negative comments as well. So as part of the process, as we've done every year, when we get the surveys back, those individuals that left their name, left a comment, that we can get hold of them. We ensured that the relevant supervisor followed up directly with those individuals to address all concerns. Yeah.
Okay, thank you. Could I have a mover, please? Councillor Murphy, second. Councillor Yan, any questions? Councillor Nicholson.
Just one question on strategic pillar number 2, it talks about the living classroom option for Miramichi. I know that we had previously done it, want to share. Is it still open to that? Should there be a sufficient intake of PSWs?
Through your chair to Councillor Nicholson, yeah, it was on the report. It was recently removed as a result of, unfortunately, they didn't have the critical mass to run the class this particular year, but it's on our radar each semester that when it comes up. So we're just finished up the Miramichi Lodge living classroom with hopes to be able to repeat that again at the Lodge, where that's yet to be confirmed as well.
Thank you. Any further? Seeing none, all in favor? That is carried. Thank you. On to item number 8, please, Mr. Blackmore.
Sorry. Item number 8, a recommendation that the Health Committee approve the proposed changes to the home's user fees, and further that these changes be forwarded to the Finance and Administration Committee to recommend County Council approve the amendment to the County of Renfrew user fee bylaw. And as background is attached to Appendix Long-Term Care 3, the user fees associated with the homes. Committee is advised that the homes are proposing no changes other than a $5 increase to the Bonnechere Manor Senior Adult Day Program from the full rate of $20 to $25, and the removal of the half-day rate and bath-only rate. This would be the first increase to the full day program rate in 12 years and would help offset the increase in food and transportation charges.
Thank you. Could I have a mover, please? Councillor Wilmer, seconded by Councillor Grills. Any questions, comments? All in favor? That is carried. And moving directly into bylaws then, please, Mr. Blackmore.
Thank you, Chair. Bylaw number 9 is the long-term care service accountability agreement. Recommendation that the Health Committee recommend that County Council authorize the Warden and the Chief Administrative Office Clerk to sign the long-term care service accountability agreements from April 1, 2023 to March 31, 2024 between Ontario Health and each of the Bonnechere Manor and Miramichi Lodge for submission by the Ontario Health approved extended deadline of April 27, 23, and further that County Council pass a bylaw to amend bylaw 30-22, being a bylaw authorizing the Warden and Clerk to continue the long-term care service accountability agreements. As background, Bonnechere Manor and Miramichi Lodge each entered into a long-term care service accountability agreement with Ontario Health with a request to sign the LSAs for each of Bonnechere Manor and Miramichi Lodge from April 1, 2023 and March 31, 2024, and submit by the Ontario Health approved extended deadline of April 27, 2023. The LSAs are attached as Appendix Long-Term Care 4.
Thank you, Mr. Blackmore. Can I have a mover once again, please? Councillor Nicholson, seconded by Councillor Grills. Questions, comments? Seeing none, all in favor? That is carried. Thank you. And finally, item 10, Mr. Blackmore.
Item number 10, a bylaw, a Bonnechere Manor Senior Adult Day Program Multi-Sector Service Accountability Agreement. A recommendation that the Health Committee recommend that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the Multi-Sector Service Accountability Agreement from April 1, 2023 to March 31, 2024 between Ontario Health and Bonnechere Manor Senior Adult Day Program for submission by the Ontario Health approved extended deadline of April 27, 2023, and further that the County Council pass a bylaw to amend bylaw 31-22, being a bylaw authorizing the Warden and Clerk to continue with the multi-sector service accountability agreement. Background, Bonnechere Manor has been operating the Senior Adult Day Program in Renfrew since February 1997. For the continuation of the funding for the Bonnechere Manor Senior Adult Day Program, Ontario Health is requesting the signed multi-sector service accountability agreement from April 1, 2023 until March 31, 2024, and submitted by the Ontario Health approved extended deadline of April 27, 2023. The MSAA is attached as Appendix Long-Term Care 5.
Thank you, Mr. Blackmore. Can I have a mover, please? Councillor Wilmer, seconded by Councillor Purcell. Once again, any questions, comments? Seeing none, all in favor? That is carried. Thank you. Could I also now seek a resolution to approve the long-term care report, please? Councillor Murphy, seconded by Councillor Weir. Further and final opportunity for questions on any item. Seeing none, all in favor? That is carried. Thank you. At the time of the distribution of the report, Mr. Kelly, there were no Board of Health minutes. Does that remain so?
It does, Chair.
Thank you. Under new business, I was remiss. I meant to get to this at the outset of the meeting today. So I wanted to note April 9th to 15th is recognized as National Public Safety Telecommunications Week. This week provides an opportunity to celebrate hardworking staff in emergency communications centers who dispatch first responders during the greatest times of need for residents. In Renfrew County, this includes the incredible men and women working at the Renfrew Central Ambulance Communications Center, who provided 911 dispatching services 24/7, 365 days a year, assisting paramedics and firefighters get to residents and visitors of Renfrew County, South Algonquin, and Algonquin Park. These ambulance communications officers are the first point of contact for citizens dealing with an emergency and serve as a vital link between members of the public, the County of Renfrew Paramedic Service, and fire departments across the county. They demonstrate professionalism, understanding, and compassion day in and day out while performing their duties. I am informed by the Chief that, in fact, this past week, I believe that they did participate in the arrival of a new resident of the County of Renfrew, a very successful birth. The County of Renfrew would like to acknowledge the great work of the ambulance communications officers and recognize them as key members of the emergency response team throughout Renfrew County who play a significant role in supporting our community. So thank you, and take note of the National Public Safety Telecommunications Week. And I believe, Chief, you also have an item of new business.
I do. Thank you, Mr. Chair, and through you to members of committee. It comes with a mixed emotion that I let you know that today will be Brian Leahy's last Health Committee meeting with us here at the County of Renfrew. Brian has announced his retirement from the paramedic service, and it's been quite a ride. Brian and I started our careers together 33 years ago. And Brian has been a pillar of our profession throughout the Ottawa Valley and well beyond. Brian's been recognized internationally for his work within our drone program, and Brian is revered by many in the community. I can't walk into a grocery store or the Irving without somebody stopping me and saying, "Hey, do you know Brian Leahy?" So I've started wearing an overcoat when I walk around town. But you know, Brian is very deserving not only of the accolades from committee, council, and the broader community, but you know, Brian's family has played an instrumental role in his availability. Brian's one of the people you can call 24 hours a day, 7 days a week, and the answer is always the same: where do you need me? And Brian's been unbelievably loyal to his profession, to his community, has personally treated thousands of people as a paramedic, and has had now well over a decade of service functioning as the deputy chief of this paramedic service, and has done an extraordinary job of being kind, of being consistent, of being fair, and of being present both here in the county administration building and also to staff, our partners in the union, partners in dispatch, and so on. So Brian, a huge thank you to you for everything that you have done, and I'm sure will continue to do in whatever capacity you choose next. Your family's lucky to have you back, your horses are lucky to have you back, and be sure that I'll be calling you for a weather check when the skies don't quite look right. So thank you, Brian, for everything that you've done.
Hear, hear. Congratulations, Deputy Chief Leahy. I'm told that it would have come sooner, but you had extra time added for bad behavior. There is a closed meeting this morning, so I would now seek a resolution to move into a closed session pursuant to Section 239 of the Municipal Act 2001 as amended for the purpose of a proposed or pending acquisition or disposition of land by the municipality or local board. Councillor Nicholson, seconded by Councillor Purcell. All in favor? That is carried. Thank you. Thank you. Welcome back, everyone. We are at item number 12 on our agenda. It is the date of our next meeting shall be Wednesday, May 17th, 2023. I would now seek a motion to adjourn, please. Councillor Wilmer, seconded by Councillor Grills. All in favor? That is carried. We are adjourned. Thank you very much.